Thanks everyone for your excellent overview of Keratoconus so far. So I thought I'll probably follow up with some interesting insights that we learned about Keratoconus, more from the perspective of how prevalent or how common this disease is, and what we've seen and learned in the last 30 years, and what to expect going forward. So, what I'm going to be sharing with you right now is the data that we've analyzed thing that we've seen that is more common than before. You've also heard from Professor Titial about the epidemiology and how common keratoconus is getting, especially in the Indian subcontinent. So I won't be covering that. But also would be important for us to pay attention to why the future might be. So just to summarize some of the important findings is the fact that the prevalence of keratoconus seems to be on the rise. That is, we're seeing more and more patients with keratoconus from what Professor Titial shared with you. And keratoconus is common in certain geographies and ethnic groups, seems to be much more common in the Middle East and in the Indian subcontinent. And also, it seems that these ethnic groups are more susceptible to developing keratoconus. It also seems to be appearing at a younger age in Asians, and we've been seeing patients who are as young as 7 years with keratoconus. But the most common age group as of now is the early teens. And interestingly, data from India is still limited about how frequent keratoconus is. So the data that I'm going to show you is collected from our network of 210 centers, mainly based at Hyderabad, but also in the three states of Telangana, Andhra, and Odisha. Again, when we looked at the total distribution of the different problems of corneal diseases that came to us, we found that about 11% of all patients who had corneal disease had allergy, and about 7% of all patients who had corneal problems came to us who had keratoconus. Then we also looked at the number of patients who had corneal blindness, and also the number of patients who required keratoplasty or corneal transplants. And we found that of all the patients who are blind or who had very poor vision, 7% of them had very poor vision because of the keratoconus that they had. So over the last 30 years, we looked at about 20,500 patients, and we found that the majority of these patients were male. And in fact, two-thirds of these patients were male, only about one-third were female, showing that keratoconus is much more common in males as compared to females. Another interesting insight we found when we divided the keratoconus that we saw in the institute into 5-year blocks was the last 10 years accounted for the majority of patients whom we've been seeing, which means that the number of patients of keratoconus has actually shown an exponential increase. And about 70% of all the patients that we've seen in keratoconus, males, females included, we've seen in the last 8 years, compared to about 30% in the 22 years before that, which means that keratoconus is becoming more frequent. Interestingly, we also found that the average age at which patients who have keratoconus come to us earlier in the 1980s and 1990s was about 29 years, but now this has come down to 22 years, which is also showing that keratoconus is presenting at a much younger age as compared to what it was earlier. We also looked at what kind of interventions we do for keratoconus over the last several years. And like you see, the blue line shows the total number of interventions or surgical procedures or any procedure that we do for keratoconus. And obviously, the line is very steep because the number of patients are more. But in general, you see that contact lenses seems to be one of the commoner methods in which we manage keratoconus. Cross-linking is seeing an increase in the numbers, but we'll look at that data a little more carefully. So if you divide all the interventions and look at which patients are getting what, it still seems that the majority of our patients are still being fit with contact lens, even in the last 10 years or so. So the majority of patients are visually rehabilitated with contact lenses. A small proportion undergo corneal transplants, but a very large proportion, especially in the last 10 years, are undergoing collagen cross-linking as a stabilizing procedure. When we looked at the contact lens usage pattern of keratoconus patients, we found that there is an increase in the percentage of patients who come to the clinic who are using contact lenses. And this coincides with different kinds of specialty contact lenses that have been released. And in fact, we've seen that some specialty contact lenses like scleral lenses have increased the number of patients who are wearing or who are using contact lenses quite comfortably at this point of time. The average age at which patients start using contact lenses from the 1990s to now has really not changed very much. It seems to be just about the same. When we talk about surgical procedures per se, excluding contact lenses by percentage, we still see that in the last 10 years, there is an increasing percentage of patients who are undergoing collagen cross-linking, like Dr. Namrata shared with you, and lesser number of patients are undergoing transplants or penetrating keratoplasties, which is a good thing, which means that we are able to detect and also stop the disease earlier by doing cross-linking rather than subjecting these patients to corneal transplants. There is a procedure that we also briefly seem to have a rise, which is called intracameral perfluoropropane gas or C3F8, which we started doing in 2007, following a publication from our institute, and this became very popular. But then again, it started coming down with time, and we don't see as many acute hydrops, which is a complication of keratoconus, potentially because of the fact that we seem to be cross-linking a lot more than before. The other interesting aspect is if you compare the percentage of cross-linking with corneal transplants, like I shared in my earlier slides, you still see that the cross-linking percentage of all patients that we do is going up quite significantly, and there is a smaller proportion of patients undergoing corneal transplants. So this potentially is because when we started doing cross-linking in 2007, we found that in 2008, only about 0.5% of patients are undergoing cross-linking, but now about 6% of all keratoconus patients are undergoing cross-linking. That translates to about 1,300 cross-linking procedures that we are doing per year in this 5-year period, which is quite significant from the point of view of surgical intervention. So the age at which cross-linking is being done is also younger and younger. Earlier cross-linking, the average age was closer to 20. Now the average age is closer to 18 years. So we are actually cross-linking patients earlier than what we used to do in about 10 years ago. When we're looking at corneal transplants, we find again very interesting trends that the total number of lamellar keratoplasties, that includes the kind of keratoplasties we do most commonly for keratoconus, is actually going down over the last 10 years. And then when we look at the proportion of full thickness transplants, which is in green, versus lamellar or partial thickness transplants, which is in gray, we find that the percentage of partial thickness transplants has crossed 50%, and that is the majority of kind of corneal transplants we do nowadays for keratoconus as compared to full thickness penetrating keratoplasty a few years ago. Another interesting aspect is as the number of cross-linkings have increased, we found that the number of corneal transplants have proportionately decreased with time, corresponding to the fact that cross-linking seems to result in less requirement of corneal transplants. The average age at which we're doing corneal transplants also has come down from 29 years to about 22 years, which is also quite interesting. So to summarize what we found from our data over 30 years, we find that keratoconus accounts for about 7% of all corneal disorders that come to the hospital and about 7% of all transplants that we do in the hospital. The incidence of keratoconus is rising over the last 3 decades, and the age at which keratoconus patients are presenting is getting lower and lower. Contact lenses and cross-linking seem to be reducing the need for transplants, and hopefully in the future, we won't need to do transplants at all for keratoconus. The other interesting aspect is also about the age. We find that the majority of patients with keratoconus tend to present between 11 years and 30 years. Or more than 80% of patients who have keratoconus are actually in this group. And again, like I said, males have much more commonly have keratoconus as compared to females. When we also looked at the socioeconomic distribution, 91% of patients who had keratoconus were from upper socioeconomic strata, whereas only 8% were from lower socioeconomic strata. This potentially has something to do with geography as well, where we found that close to 50% of all our keratoconus patients were from urban areas, and about 65% were from cities or urban areas, and only one third of the patients with keratoconus were from rural areas. The vision at presentation also, we found that there is a significant number of patients who had severe visual impairment at the time of presentation. So it is important to actually be able to detect keratoconus earlier than later. Another interesting aspect, like Dr. Kityal mentioned, is the fact that a significant number, 12% of all our patients had serious eye allergies at the time of presentation, which shows that allergy probably is a predisposing factor for keratoconus. And when we looked at our publication from LVP about what is the most common age for allergy, we found that the most common age of patients who actually come with allergy is between 3 years and 11 years, which is just before the age of onset of keratoconus. So eye rubbing is something that is very important, that is increasing the prevalence of keratoconus. When we also looked at the severity of keratoconus, with grade 4 being the most severe, grade 3 little less severe, grade 2 and 1 being milder, we find that keratoconus presents more in more severity in a bimodal fashion. That is, children who come to us between 0 and 20 years seem to have more severe keratoconus, and adults above 40 years have more severe keratoconus, but those between 20 and 40 have less severe disease when they present in the hospital. When we compared males and females, interestingly, though the prevalence of keratoconus is lesser in females, they tend to have more severe keratoconus as compared to males when they present to the hospital. And we also looked at where the area the patient is coming from and what kind of severity they have. It seems that patients who come from cities, potentially because they have easier access to hospitals, have less severe keratoconus at presentation as compared to those who come from rural areas and semi-urban areas. So to summarize again, 80% of keratoconus seems to occur between 10 and 30 years, and there is a male skew with 2/3 of all keratoconus occurring in males. It seems to be more common in the upper socioeconomic strata and in urban areas. Close to 15% of patients have severe visual impairment, so it is a serious problem that needs to be taken seriously. At presentation, females have more severe disease, and semi-urban and rural patients tend to present with more advanced stages of keratoconus, possibly because of access. Interestingly, in the next maybe 10 years or so, cross-linking and new varieties of contact lenses are going to be game changers for keratoconus. It is very important for increased suspicion in young patients with refractive errors or glasses that are not stable to be scanned for keratoconus. The key to preventing a lot of the complications in keratoconus is early cross-linking and monitoring to reduce the need for transplants. And again, in the future, keratoconus is not a disease that is limited to hospitals alone. It is very important for everyone to realize that this is a public health problem, and it's important to do community high school screening programs to ensure we pick up keratoconus early and also intervene early, because the number of years a child who has keratoconus has to live or deal with keratoconus is probably about 60 to 70 years, which is quite significant. And keratoconus is resulting in significant vision impairment if it is detected late. Thank you very much for your kind attention.